Thank you for joining us for the overview of the Cleveland Metropolitan School District's 2018 benefit plans. I am Steve Liggis, Vice President with Highland, and serve as CMSD's consultant on its employee benefits program. I will be your host for this recording. November 2017 serves as the open enrollment period for CMSD's benefit plans. Open enrollment is your annual opportunity to review your current plan elections and make any changes in those elections for 2018. The CMSD open enrollment period runs November 1st to November 30th, and any changes in your elections during this period will be effective January 1st, 2018. It is important that you take the time to understand your options and make the selections that are right for you. Unless you have a qualifying event such as getting married or divorced, having a baby, or losing other coverage, the elections you make during open enrollment cannot be changed after November 30th. In deciding which plan options are right for you, it's important to understand who's eligible for coverage under the various CMSD plans. All employees working 19 or more hours per week are eligible for coverage under the CMSD plans. Their legally married spouses are also eligible for coverage for all CMSD-sponsored plans. Coverage for dependent children is extended based upon the coverage option. All three medical plans offered by the district extend coverage to age 26. Dependent children are eligible to remain covered under the dental plans to age 19 or age 23 if a full-time student. If you are eligible for coverage in the Union Eye Care plan, your dependent children may remain on the plan to age 19 or age 23 if a full-time student. Coverage under the United Health Vision plan is extended to age 26. Finally, dependent children are eligible under the Life plan to age 21 or age 23 if a full-time student. Please note that because life insurance is purchased on a unit basis, it is your responsibility to notify the district if your child or children have aged past eligibility for life insurance so that that coverage option is removed from your elections. Based upon the dependent coverage selected, you may be asked to provide proof of eligibility for your dependents. Any of those requested proof documents should be uploaded through the Workday system. Examples of documents that may be requested include your most recent federal tax return, a copy of a court order requiring coverage of a dependent, and birth or adoption certificates. There are various changes that have been made to the benefit plans offered by the district for 2018 that we'll cover in greater detail throughout this presentation. Those changes include the new Wellness Incentive Certification, a new third healthcare option called UH Choice to replace the former HealthSpan plan. While not new for 2018, as of October 1st, 2017, Medical Mutual has expanded its network to include all University Hospital System facilities, including the previously excluded main campus, which includes Rainbow Babies. The Enhanced Dental Plan has been further enhanced to include coverage for implants, as well as increased annual and orthodontia limits. The maximum allowance under the Healthcare Flexible Spending Account, or FSA, has been increased to reflect the 2018 IRS limit of $2,650. Finally, the enrollment system itself has changed to the new Workday system. As a result of this last change, you no longer need a PIN as was required under the previous system. Instead, log into your Workday account. You'll find the link to complete open enrollment in your Workday inbox. Unlike the old system, you may revise your elections anytime up until the November 30th deadline by revisiting your Workday account. So what are the various plan options available to CMSD employees? CMSD offers 3 comprehensive medical and prescription plans, 2 dental plans, 2 vision plans with eligibility determined by your collective bargaining agreement, employer-paid basic life, 2 employee supplemental plans, and an option to buy coverage for your eligible spouse and dependent child or children, both healthcare and dependent care flexible spending account options, and finally an employee assistance plan or EAP. We will spend the majority of this recording reviewing these plans in greater detail. So let's get started with an overview of the CMSD medical and prescription plan options. CMSD will continue to offer the Aetna and Medical Mutual plans for 2018. While there are no changes to either of these plan designs, I would like to take a moment to review how the plans work. Both the Aetna and Medical Mutual plan networks provide very good access to care throughout Northeast Ohio. As a result, I will concentrate on the network benefits for these plans for purposes of this overview. Both plans offer coverage without a deductible or coinsurance responsibility to a member for covered services. That means you do not have to pay an upfront out-of-pocket cost with the exception of copayments when you use network participating providers. When you need to see a physician, you are required to pay an office visit copayment of $15 for a primary care physician or PCP. PCPs include not only your general physician, but also pediatricians and gynecologists. If you're seeing a specialist, you will be asked to pay a $25 copayment. Specialists include physicians specializing in certain care, such as a cardiologist or nephrologist as an example. Preventative care is included under the plans at no cost and does not require an office visit copayment. Should you need to visit an emergency room or urgent care facility, those are also subject to copayments of $75 and $35 respectively. Each of these plans also includes coverage in an Express Scripts prescription program administered by Medical Mutual. Coverage for a 30-day supply under the plan is based upon retail copayments of $5 for generic drugs, $10 for formulary or preferred brand drugs, and $15 for non-preferred drugs. The plan also provides mail order coverage for ongoing maintenance drugs, which provide up to 90-day supply for 2 times the retail copayment. As a result, you save yourself 1 month's copayment over the 3-month period. As I mentioned earlier, the district is also excited to announce the addition of a new option called the UH Choice Plan for 2018. The UH Choice Plan is an exclusive network offering centered around the university hospital system. All UH facilities and physicians are part of the UH Choice network. Additionally, there are over 2,000 independent physicians that are contracted to participate in the plan. To see if your provider is part of the network, you may check provider status by visiting the UH Choice Provider Directory at www.myuhchoice.com and clicking on the Member button. Like the former HealthSpan plan, this plan provides only coverage for services provided in the UH Choice network. There are no out-of-network benefits except for emergency services. In an emergency, please find the nearest emergency room that can provide the services you require. While this network is centered in Northeast Ohio, it does allow for coverage of dependents that may reside outside of the area, such as the child away at college, through the First Health Network. Should you have a child out of area, you will be able to register their residence with UH Choice in order to access benefits through the First Health Network. Further instructions on this registration process will be provided upon enrollment in the UH Choice plan. The UH Choice program not only provides you lower amounts you contribute through your portion of costs taken through your payroll deduction if you choose to elect the UH Choice plan, but it also provides you lower out-of-pocket costs when you use the plan as well. The primary care office visit copayment is $10. The emergency room copayment is $50, and the urgent care copayment is $25. Like the Aetna and MMO plans, this plan also provides prescription coverage through Express Scripts and is administered by Medical Mutual. However, like the HealthSpan plan, there is no differential between preferred and non-preferred drugs, so the copayment is $10 for covered brand prescriptions. Also, like the HealthSpan plan, this plan provides you a 90-day supply at mail order for exactly the same copayment as retail. So in essence, you save yourself 2 copayments every 3 months. CMSD has introduced a new wellness incentive for 2018. To qualify for the reduction in premiums, employees and spouses, if covered as primary under a CMSD medical plan, must submit a completed physician certification form. The form itself consists of the physician certification for the completion of the required exam and testing elements, as well as certification that the individual submitted a completed health risk assessment to the physician. Please note, only the certification form itself and not the actual health risk assessment should be submitted for the wellness incentive. The deadline for submission of the completed certification was October 31st, 2017, and will be reflected on your deductions in 2018. For those newly eligible or newly covered under the CMSD health plan, the deadline for submission of the physician certification form is 60 days following the initial eligibility for coverage. Copies of both certification form and health risk assessment can be downloaded and printed through the Employee Benefits page of the CMSD website under the Departments tab. If you qualify for the incentive, you will see it reflected on your 2018 pay stub, but will also see it as a credit as you go through the Workday enrollment process. While the district provides some of the most comprehensive plans around, your health and costs also depend upon you. Making sure you are doing the things to keep you healthy, including regular exercise, healthy eating habits, stress management, and avoiding tobacco use, are ways to not only live healthier now, but also to ensure your health long term. And most of us could probably use resources and support in any one of these areas. All of the health plans provide further information and resources, not only in these areas, but almost any other as it relates to your health. Please check them through their websites or call them for further information. As mentioned during the medical plan overview, always be sure to use network providers, including for labs and x-rays when you need those services. The costs for out-of-pocket are significantly more when you use non-network services. Finally, maintain a relationship with your primary care physician. The goal of the CMSD Wellness Incentive Plan is to provide an incentive to establish and maintain your relationship with your physician to help promote your long-term health and well-being. Hylant Script Navigator is a public service we provide not only to members of the district, but to the general public as well. Most of the retail pharmacy chains provide generic incentive plans, with fixed co-payments of $0 or $4 as an example. However, each of the pharmacy chains has its own program drugs. Among the services Hylant Script Navigator provides is an up-to-date list of those programs and the closest location to your zip code search. Simply input the drug, dose, and zip code, and the site will tell you if the drug is available in an incentive program, with the cost in the nearest location. As I mentioned, this is not exclusively for CMSD members and does not require a username or password. There's also no membership to join. So please feel free to share this site with anyone that you feel could benefit from the information. Now I'd like to turn our attention to the CMSD dental plan options. CMSD offers two dental plan options to participants. Both plans are administered by MetLife and use the MetLife provider network. The basic dental plan is provided at no cost to employees and eligible dependents. The plan provides up to $1,500 in covered dental services per covered person per year. For a family, each member of the family has her or her own $1,500 annual benefit limit. The plan provides for 100% coverage of preventative services such as cleanings, exams, and routine x-rays. The plan will pay 80% of covered charges for basic services such as filling a cavity and 20% of covered services for major services such as a crown. The plan will also pay 20% up to a lifetime limit of $1,500 for orthodontia for dependents up to age 19. You also have an option to elect the enhanced dental plan by paying a contribution through payroll deduction. This plan provides up to a $2,500 annual limit and orthodontia lifetime limit services. This is an enhancement from the current $2,000 limits in place for 2017. Additionally, the plan provides coverage for major services at 80%. Finally, as mentioned in the introduction to changes in 2018, the enhanced plan now also includes coverage for dental implants. Dental implants still remain excluded from coverage under the basic plan. The district also offers two vision plan options dependent upon your union affiliation. Locals 244, 407, and building trades are eligible to participate in the union eye care plan. The plan provides an eye exam once every 24 months at a $40 copayment. Should you need glasses or contacts, those are provided up to a $70 allowance once per 24 months or once per 12 months for dependents up to age 19. Contact lenses are included up to a $100 allowance at the same frequencies. All others are eligible for the United Healthcare Vision Plan. The UHC Vision Plan provides an eye exam once every 24 months or annually for dependents up to age 19. There is no cost for this exam. Lenses and contacts are subject to a $45 copayment and are available on the same frequencies. Flexible spending accounts, or FSAs, allow you to set aside money for eligible expenses on a pre-tax basis. There are two options you may contribute to. The first is a healthcare FSA. The healthcare FSA allows you to contribute up to $2,650 towards your account. The account may then be used to pay for eligible expenses. Under the healthcare FSA, the total amount of your annual deduction is available to you to pay for eligible expenses at the start of the plan year. Your contributions to the account are deducted across the entire year on a per paid basis by dividing the amount you selected by the number of pay periods. Some important considerations. The IRS has strict requirements around these accounts. Money in the account can only be used to pay for eligible expenses. You are not able to change the amount of your election during the year, and any money that's left in the account is forfeited at the end of the plan year, subject to the extension rules under your CBA. Dependent upon the structure of your plan, you may have the option to carry over up to $500 in unused balance that does not expire. The second option is that you may carry over your entire balance, but it must be used by March 15th of the following year. This is not a personal choice, but is based upon the plan provision of your agreement. All non-union employees are subject to the non-expiring $500 carryover provision. Should you choose to participate in the plan, you will receive a debit card preloaded with your account balances. You may use the card to pay for your out-of-pocket costs, like co-payments at the time of service using your debit card. You may also use it later, after the fact, once you receive a bill, like a charge card, to pay your provider bill. You may also choose to pay out of pocket and submit manual claims at any time prior to the claims filing deadlines for that plan year. Items eligible for reimbursement under a healthcare FSA include things like co-payments, dental services, vision services, including prescription sunglasses, or even a second pair of prescription glasses, and even corrective eye surgery. A dependent care FSA allows you to contribute pre-tax dollars for child care for a child up to age 13, or for custodial care for an adult dependent that lives with you, for which you need care in order to allow you to work. You may contribute up to $2,500 individually, or up to $5,000 if married filing jointly. Unlike the healthcare account, your dependent care account proceeds are only available as your contributions are deducted from your payroll. The full amount of the election is not available at the start of the plan year, like under the healthcare account. Also, any provider used must file the payments as income. As a result, if a relative is babysitting, such as a grandparent as an example, you will need to provide a 1099 for any amounts you are reimbursing yourself through a dependent care account, and that individual must claim those on their individual taxes. Let's look at an example of why you may want to contribute on a pre-tax basis. Let's say you earn $50,000 and do not contribute to an FSA. There's no deduction to lower your taxable wages, so taxes are calculated on the full $50,000 as shown. You then use post-tax dollars to pay the $1,500 in expenses, leaving you $28,025 in this example for everything else. Instead, if you contributed to an FSA on a pre-tax basis, your taxable earnings are reduced to $48,500, and taxes are calculated on that amount. You now use the $1,500 you set aside through pre-tax deduction to pay for those eligible expenses that you otherwise would have paid out of pocket. As a result, if you have an additional $614 to pay for other things. Another way of thinking about this is that the $1,500 in expenses only cost you $886 because of the $614 in savings under this example. So turning our attention to life insurance. The district provides an employer-paid basic life amount for employees. Additionally, employees have the opportunity to purchase supplemental coverage under 2 employee plans, as well as spousal and dependent child coverage. Both the voluntary and portable life plans are supplemental insurance plans, providing coverage for employees above and beyond the CMSD provided benefit. In addition to the amount of coverage you may purchase under each option, the major difference between the plans are your rights to continue coverage should you leave the district. The portable plan allows you to port coverage, meaning you pay the same amount for insurance as if you continue to be employed with the district. The voluntary coverage may be taken with you as well, but rather than porting at the in-force district rates, it's eligible to convert to an individual policy at the same level of insurance. The cost of the individual policy is typically much higher than the rates in force under the group contract that you would pay for should you choose the portable option. The spousal and dependent life insurance are purchased in units. You may elect 2 levels of insurance on your spouse and 2 levels of coverage, covering all of your eligible children at the same level. As mentioned earlier, if your children all age beyond the policy, it's your responsibility to notify the district that you wish to remove the dependent life insurance coverage. Shortly, we'll discuss reasons you must access Workday during the open enrollment. While not required, I would urge you to log into the Workday system, even if you don't intend to make any other changes, in order to verify and update your life insurance beneficiaries. The insurance carrier is required to pay life insurance benefits to the beneficiary on record. The fact of the matter is family dynamics and situations change. I receive several calls a year from plans indicating that a beneficiary change was not made, and now an ex-spouse is going to receive the policy benefit. Unfortunately, there's not much that can be done in those situations. So I urge you, if for no other reason, log into Workday and make sure your beneficiaries are as you want them. Our final topic is not something that requires your enrollment, but is made available to all district employees. The district offers you a comprehensive EAP program at no cost to you. The plan provides unlimited 24/7 telephonic counseling, as well as up to 3 face-to-face counseling sessions per incident. This is a completely anonymous service, and the district receives no reporting about who or why you called Ease at Work. There's a whole host of items they can help provide assistance for, and there's a sample video that provides an overview as well as a sample of the services available on the employee benefits page of the CMSD website. So that brings us to the close of this recording, and I want to leave you with just a few thoughts on what you need to do now. The month of November is your opportunity to make your open enrollment selections that will take effect for the 2018 calendar year. All changes must be made in Workday, and while you can update Workday through November 30th, those final selections as of November 30th will be what's shown as elected by you for 2018. No one is required to log into the system if you do not wish to make any changes. However, you must log into the system to do any of the following. You wish to opt out of medical insurance in 2018. You wish to make a contribution to an FSA in 2018. Even if you contributed in 2017, the IRS requires you to make the selection annually. You wish to change any of your benefits or dependents, and you wish to elect the UH choice option. That's not a default option. You have to elect it. And again, I would personally urge you to log in for no other reason to review your beneficiaries. Resources are available to assist you with your open enrollment questions. Please feel free to visit the CMSD Employee Benefits Help Desk or check the hours of support at the East Professional Center. You may also submit questions via email to benefits@clevelandmetroschools.org. The Employee Benefits webpage of the CMSD website can be accessed by clicking on the Departments tab of the CMSD website. There you'll find a great deal of resources, including plan guides detailing plan options, contributions, and other plan documents. This will be a resource you will want to bookmark and refer to anytime you have benefit questions in the future as well. Well, that concludes this presentation. Thank you very much for listening to this recording.